Hey nurse friends, it is me, Meg from NurseMegRN.com. This video is for, again, nursing students and brand new nurses. Anyone who's struggling, that's what these videos are for. This video is particularly about how to start an IV, and it's really great if you learn this in nursing school, but if you didn't learn it in nursing school because of lack of clinicals or lack of just experience, you're normal. It's okay if you graduate nursing school knowing how to put in IVs and you're like really good at it. That's not normal, okay? So let's help you to really solidify kind of tips and tricks that you can use, things that you should be doing to start an IV. And any of the notes that I'm gonna be referring to or any of the graphics will be in a blog post, and I'll put a link down below to the blog post on my blog, NurseMegRN.com, so you can kind of go through it and refer it over and over and over. Some people don't like to like read it, some people need like visuals, or some people want me talking to them. So that's why I'm making you this video. So let's talk about like proper technique on how to start an IV and how to just like improve your skills. So I want you to like, the purpose of this video is really to like prepare you mentally and physically before you even like stick the patient, okay? So I'll give you some environmental tips and everything to really get to the point where you have the catheter in your hand. So even before you walk into the patient's room, I want you to gather your supplies. And gather like extra tape, extra gauze, because there's never enough tape in the kit. Like, don't rely on the kits completely. So bring a little extra gauze, bring a little extra tape, have it in your pocket. You don't have to necessarily take it out, but at least have it with you. And then always bring 2 kits into the room. This may vary if you're in like an isolation room of some kind. So what I like to do is like put it in my pocket or put it in my little pouch or something, and then take it out if I need it. Otherwise I can, you know, take it to the next patient or something, or save it for later. So of course, wash your hands before you go into the room. Explain to the patient that you're gonna start an IV, but kind of explain it to them like, I'm going to place a catheter into your arm to access your vein. The needle doesn't stay in your arm. A very soft plastic catheter stays in there that's super duper flexible and comfortable. And then turn all the lights on. All the lights on. I don't care. Just turn all of them on. The more light, the better, so you can really see the contrast of the veins in the tissue, not depending on like how much melanin the person has. I always like to attempt veins below the elbow. I hate the AC. IVs in the antecubital, they don't last long. They clamp really easily. If there's a continuous infusion running, you're going to be going into the room because the pump will be alarming all the time. Avoid the AC if you can. I like to start with distal veins first and then move proximally. So you really want to take a look, and if you see something right away, okay? So my reasoning is that I always put the tourniquet below the elbow, then keep it there for a couple seconds to really let the vein fill, not for like a minute, for like a couple seconds, just to fill so that you can really see the veins starting to fill up. And yes, it is supposed to be super tight. I like to use those few seconds while after I put the tourniquet on, while the veins are filling up, to start setting up the extension set and the tubing with, you know, prime it with normal saline, and then leave the flush connected in the open IV kit, just so you can be ready to like flush it or pull back, get some blood return, and then push it in. So as veins start to pop to the surface, I look around and feel with my gloved hands. Now sometimes if you see a great vein, you'll be able to learn by feel if it is going to be a good vein. If it feels like a balloon underneath there, and really determine like how deep it is. More surface level, the better. It's going to hurt the patient less and it's going to last longer. Veins are going to feel bouncy, like you're going to feel almost like a little like rebound, and you can put a tourniquet on yourself and feel like this feels like tissue. It's dense. This feels like a little bouncy balloon with the veins. All right, so once you've found an acceptable vein that you want to try to hit, open the alcohol or ChloraPrep, whatever they put in your kit, and then scrub, 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 scrub. I mean, real scrub. There's so many germs on the skin, even if like they just took a shower. So don't be afraid to really, really scrub, and also clean the surrounding area. So kind of like imagine like a little halo around the area that you're gonna go to. Scrub the surrounding areas as well. Now, if you're right-handed, like me, you're gonna grab the IV needle and uncap it with your left hand. Then with your left hand, you're gonna pull the skin down. Obviously we stick veins towards the heart, okay? Please know that. But I would like use my other hand to like push down right under and then pull the skin down. It's hard to show you, so I'm gonna show you the opposite way. Like that, like let's say I was gonna enter here, I would go right below it with the thumb, push down and then pull down to really like anchor the vein. Probably about like 1 inch or 2 below where I'm about to hit. Stretching out the skin also increases your chances of getting the catheter perfectly into the vein. It does prevent some vein rolling, not all, but it does prevent it a little bit. All right, so let's go ahead and pierce the skin and don't hesitate, because the slower you go and you hesitate and stop, it's going to hurt the patient. So if you do it in a nice swift but gentle motion, you're not gonna like stab the person. Nice, gentle but swift motion. Don't go in too fast or too slow. Too fast or too slow increases the chances of the vein blowing. So once you get a little bit of blood return like into the needle that you had, advance the catheter like 1 centimeter more, and then push the plastic part in with 1 finger, retract and pull the actual needle, and then quickly screw in the extension set. Remove the tourniquet, and then some plastic catheters have like stop lock, so you don't have to like put a little bit of pressure on where you just put it in to stop the blood flow, so you can screw in the extension set. So once you have the connected extension set to the plastic catheter, pull the syringe back slightly. Now it's gonna be like pressurized in there, so pull it back slightly to check for blood return. If you get blood return right away, awesome, flush it. Again, swift motion, not pushing, because you can blow the vein. Do it slow, gentle, and swift. You don't want to do it too fast, because you also want to make sure it didn't infiltrate, forming the little bubble of saline, and the patient may have pain with that. And if you don't get blood return, you might be at a valve. So flush it super, super slightly. And sometimes it can be good. A vein can be good, an IV could be good with no blood return, especially with these modern day kits, or if you're in a valve. And if you flush it and you see no sign of infiltration and the patient's not like, oh, that feels uncomfortable, you did it. You did it. Dress it up. Don't leave the catheter dangling, please. Curl it and tape it in a way that it's not dangling and easily caught on something. Also, once you like curl it and it has like a little curl with the tubing, tape down the end of the tubing, like the bottom U part of the extension set, tape that part, because that thing gets caught on everything. So remember, even the most experienced nurses, I've been doing this for over a decade, I still miss veins sometimes. So don't get discouraged. If you like get 3 or 4 in a row and then you miss one, don't be discouraged. If you can't get it on your patient, you might be like overthinking it, you might not be able, ask for help. Ask a more experienced nurse, hey, can you be in here with me, or can you just help me get this IV? I've tried and attempted, but please try and attempt, okay? Because practice is the only way that you're gonna get this. Don't get complacent and be like,
oh, my patient's IV came out, I'm just gonna ask the experienced nurse.
And then never try yourself. At least attempt once. It really is a game of practice, and once you do it over and over, I promise you, you're gonna get it, okay? There's nobody who's been doing nursing for years and years and hasn't tried. You're gonna get it, okay? So keep going, keep practicing, you're going to be fine. If you need any other helpful tips and tricks, come and find me on TikTok. I make videos every single day, or come browse my blog and see if there's a course or a blog post that will help you. So thank you so much for watching. Good luck out there. Have a good shift. Bye-bye.